When it comes to the health and safety of your crew, expect the best but prepare for the worst. Here are 5 key steps that will prepare you for most injuries, illnesses, and emergencies. First, know the basics. Ideally, all crew members must know basic first aid, CPR, and other emergency procedures. These and more are covered in the International Medical Guide for Ships, published by the World Health Organization. Since 1967, the International Medical Guide for Ships has been a standard reference for medical care on board ships. The Maritime Labor Convention, or MLC, requires that all ships carry a medical guide on board, showing how to diagnose, treat, and prevent health problems of seafarers. Responding to an emergency is everyone's responsibility, not just the medical officers. Crew members must be able to render emergency CPR, or cardiopulmonary resuscitation. Second, communicate. Know who's in charge and how to reach them, your procedures for a medical emergency, and who to call for consultation or advice.
Ultimately, the master of the vessel is responsible for the care that's provided on the vessel. The master is free to delegate that responsibility down the hierarchy of officers as they see fit. And then it's up to that individual, based on their experience and their training and their level of comfort. At the point wherever they feel that they're out of their comfort zone, or the response they're providing doesn't seem to be getting the anticipated result, then I would recommend that they ask for assistance.
Know your procedures and lines of communication, both on board and with shoreside medical assistance. Third, maintain medicines. Keep an adequate supply of medications and necessary medical equipment. The International Radiomedical Center, CIRM for short, provides free radiomedical assistance to seafarers around the world, 24/7, and is an essential resource to use. CIRM should be contacted in the event of a medical emergency on board, for other medical advice, or to coordinate the emergency evacuation of a patient from a ship. When contacting CIRM, provide the name, location, and coordinates of your ship, its ports of departure and arrival, and as much information about the patient and their conditions as possible, including their symptoms, medical history, age, and the treatment already provided. Make sure you can cover both routine illnesses and medical emergencies. Your medical supplies should be appropriate to your ship's size, its particular mission, and the potential hazards or illnesses you may be facing.
Every ship has different circumstances. They have different crew size, they have a different mission, they have different ports of call. And we recommend that people utilize the services of a consulting physician who has experience outfitting ships for whatever their particular mission is.
Whether you have a full-fledged on-board hospital and dispensary or a simple medicine chest, drugs and equipment must be kept current and the equipment functional and sterile. Controlled medications must be secure and safe.
You want to have a full complement of gauze sponges and suture material, tape in order to stabilize these things. Ace wraps are very useful. Splinting material is also extremely beneficial.
Medicines range from ointments and cold pills, which you might buy at the local pharmacy, to sophisticated drugs for medical emergencies like cardiac arrest. When in doubt about proper medication, communicate.
We do recommend that people call us before starting any of the prescription medications, of which antibiotics are one.
The typical medicine chest will include antiseptics to clean wounds. MLC regulations now require vessels to keep a medicine chest on board. You may find that some flag states have additional requirements for the medicines and equipment to be kept in a medicine chest. Those that don't rely on a basic list included at the back of the International Medical Guide for Ships. These include drugs for the eyes, ears, nose and throat, respiratory prescriptions, and antibiotics. A variety of emergency medicines like atropine and nitroglycerin, and basic medical equipment.
Here we have a suture kit, and the suture kit you can see comes with some nylon suture. The size is 4/0, and it gives a needle size on here as well. You can also, in these kits, you can see the needle. The kit includes some sterile drapes, which you can see down below there, some gauze pads, a pair of needle holders, a pair of scissors, and a pair of forceps for moving the skin around and bringing skin together.
The rule of thumb with medicines is better to be overstocked than understocked, especially when the unexpected happens. The fourth key to preparation is to keep good records. Access to crew medical histories is very important. Keep records of any previous illness and injuries. Record any treatments given and all communications relative to those treatments. The better you know the personnel, the better you'll be able to treat them. It's especially important that you know any allergies or sensitivities to various drugs.
Keeping a good medical record is very, very important for the crew member that you're assisting, for yourself as a medical officer when you may need to provide an explanation as to why you did or didn't do something, and for the vessel owner. It becomes a very, very important document. So I encourage very compulsive record keeping.
A final key to preparation: when appropriate, use sterile disposable equipment always. Check the integrity of all packaging and know the proper use of all sterile materials. Take special care to ensure proper disposal.